good morning, good afternoon, good evening. You're listening to the Thai Expat Daily Show. I'm your host Kieran Mack and thanks for tuning in. Don't forget to like this video if you're watching us on YouTube and please do subscribe. We are also available on Apple Podcasts, Spotify, Amazon and a host of other podcast players. Now that that's all done, let's just jump into today's show. The first thing we'll start off with will be the COVID numbers for today. The daily death toll climbed to 87 deaths in the past 24 hours, and the number of total infections is also up to 9,317. We're pretty much now have hit the 9,000s, and I guess the next number to aim for is the 10,000s. But let's, in all honesty, hope we don't get up that far. It is becoming a bit concerning. The numbers are certainly not going down and measures don't seem to be working, but we'll see how this lockdown in Bangkok works out and whether or not it has some effect on these daily numbers. And yet again, our favourite subject, which is the Phuket Sandbox model, has a number of stories that have come out of it today. The Phuket officials deny claims unhappy Sandbox tourists have gone home as fake news. Vice Governor Piapong Chuwang has denounced posts on social media that the Phuket Sandbox tourists unhappy with their holiday have already flown home as fake news. Vice Governor Piapong explained this morning that a Facebook post making the claim had been shared many times and that some news agencies had reported it as news. A few days ago, I saw a news article saying that some Sandbox tourists had packed their bags and flown back to their home countries before completing the required 14-day stay because they were not satisfied with our Phuket Sandbox measures, he said. I have checked with our staff and found that the information is not true. We have had some tourists fly back home, but they left because they did not want to enter quarantine. It's their right to do so, as they were only high-risk people and had tested negative for COVID-19, he said. I would also like to ask every person to consider and think first before believing any news, he added. Phuket Provincial Public Health Office Chief Dr. Kusak, who also joined the live broadcast this morning, which was chaired by the Phuket Governor, explained that tourists can fly out of the country anytime if they have tested negative for COVID-19. Some tourists came to Phuket under the Phuket Sandbox scheme, stayed less than 14 days and flew back to their home countries, he said. According to the Sandbox measures, tourists must be tested for COVID 3 times, including the day of arrival on day 7 and day 14, so they can go to other provinces, he said. If they want to fly out of the kingdom, they do not need to stay for 14 days. They need to test negative, otherwise we will not let them fly out, Dr. Kusak said. I received a report that some were 3 groups of tourists who had already flown back to their home countries. The first group were the 14 tourists who were considered high-risk people and did not want to do quarantine at a local quarantine venue, he said. The second group were tourists who came here to do errands and business for a few days. And the last group were tourists who already planned to stay in Phuket for less than 14 days. This may be because they had only a short holiday, he said. We all have taken care of tourists very well, Dr. Kusak concluded. Now that's a little bit of an odd one there, that you have to test negative so you can leave. I'm not quite sure that's a requirement anywhere in the world. As far as I thought, the only requirement to leave was the requirement of the next country that you flew on to. That seems to be a little bit of a porky being told there. Why would you have to test negative so you could leave? That makes absolutely no sense. If I come for 5 days, I don't get to the day 7. If the airline require me to have a COVID test to board the plane and go, that's okay. But it's certainly nowhere within the Phuket Sandbox rules and regulations that you have to have a COVID negative test to be able to leave Phuket. So that's also another bit of a, let's call it a porky being told by some of these guys recently. Also then we jump into another story where we have seen our 7th foreign tourist found infected in Phuket. Another tourist who arrived under the Sandbox program was found infected with COVID-19 on Tuesday, bringing the total to 7. Dr. Kusak said the 7th case is a woman from South Africa, the friend of a South African man earlier found to be infected with the virus. The 7 infections to date are a man from the United Arab Emirates, 3 female tourists from Myanmar, a man and a woman from South Africa, and a man from Switzerland. Yes, another COVID case within the Sandbox model, which, I mean, is going to be expected. We expect that we are going to have infections from inbound passengers. I guess what stands out to me is the lack of information that has been given out about it, whether or not it was on their second test, was it their first test? This kind of information is very valuable for people, and it makes it more transparent. I think when they start keeping the information to themselves, that's how fake stories and fake news stories arise, because people start to make up their own stories about what's going on and what's happening. So in my opinion, it would be good if the Phuket office were a lot more transparent with these cases and exactly where they've picked up the infections, and be honest about it. What do you think? Do you think it's in their benefit to tell people exactly where the infections are coming from rather than blanket silence over it? Love to know your comments if you'd leave them down in the comments section down below. Now, I just had my lunch and I had a lovely geng pa with fish, which is basically a jungle curry with fish, some riceberry and vegetables. And it got me thinking, what kind of Thai food do you guys like? What's your favorite Thai dish, your go-to dish? Would love to know. If you could leave your comments down below in the comments section. Another one of my most favorite Thai dishes is pad kaprao with chicken or pork, which is basically minced pork or chicken stir-fried with basil and chilies and a little bit of garlic. Delicious. Can be quite spicy, but very, very delicious. So anyway, as I asked before, what is your favorite Thai dish? Also, the Samui Plus plan will come into effect July 15th. So I will not cover it in this video, but I will do a specific video on the Samui Plus plan, which I will post sometime later after this video during the day. So if you're interested in that, do keep your eye out for that video. Now, vaccine policy switch leaves health services confused. Hospital and health offices have been left confused over the mixing of doses of Sinovac and AstraZeneca vaccines after the Prime Minister questioned the Health Ministry's latest policy to curb the spread of COVID-19. The provincial health offices in Nonthaburi on Wednesday opted to postpone its plan to give people who had received a single dose of the Sinovac vaccine a dose of AstraZeneca as their second jab. Some private and public hospitals in Chiang Mai, including Hang Dong Hospital, announced they would provide no vaccination service on Wednesday. Nonthaburi was the first province to adopt the ministry's new policy after it was endorsed by the National Communicable Disease Committee on Monday. The panel was chaired by the Public Health Ministry. Nonthaburi announced its decision on Tuesday, only to immediately suspend its implementation on Wednesday morning. In Chiang Mai, the Provincial Public Health Office also announced its suspension. In order to end the confusion, all health units are ordered to stop vaccine service on July 14, 2021, Hang Dong Hospital posted to its message board on Facebook. Mr. Anatan said the committee meeting on Monday that mixing the Sinovac for the first dose with AstraZeneca for the second would yield a better defense against the highly transmissible Delta variant of the coronavirus first detected in India. However, Prime Minister Prayut called for a thorough study of the jab policy shift during Tuesday's teleconference cabinet meeting to take into consideration the safety of vaccine recipients. The Prime Minister's reaction followed a warning from the World Health Organization on Monday that individuals should not mix and match vaccines. Respected virus expert Yang Puvarawan on Tuesday was adamant using Sinovac and AstraZeneca vaccines in series was safe and effective and Thailand's best option for fighting the fast-spreading Delta variant. Government spokesman Anuka Burakhashari on Wednesday explained that the Prime Minister did not order the plan cancelled, but he hoped the committee to be open for more reactions first. Government's priority was to see more people inoculated, as that would reduce the rate of daily fatalities and new infections, he said. Now, where to begin on all of this? Firstly, it started out with the government coming out to say that Sinovac first, followed by a second jab of AstraZeneca, would give better coverage. But unfortunately, this is not actually backed by any science. Well, definitely according to the World Health Organization. So what basically has also happened is now the Prime Minister has kind of overruled them, and it seems that the right hand doesn't know what the left hand is doing within government. Now, considering that the Public Health Minister is also the Assistant Deputy Prime Minister, you'd think they would be in conversation with each other once in a while. I'm not sure where this leaves people. A lot of people had their vaccination shots cancelled today because of this. And that's highly unfair. People have probably been waiting a long time to get in for their vaccination, and then to be cancelled because of this just nonsense. I mean, none of it's backed by any science, and that's what the problem here is with the government's policy. And also there comes down to another issue. If you do this and you take one shot of Sinovac and then one shot of AstraZeneca, you're using up the AstraZeneca that you would have already been using for people to be vaccinated on the regular dosage scheme as such. You're actually not going to have as many vaccines as you thought you would have, and the idea of getting the country vaccinated before a certain period of time is just not going to happen. AstraZeneca's supply is very poor here in Thailand right now, and we're getting about 50% of what they actually have promised. So all these decisions need to be thought out a lot more before making them, and certainly just announcing them on a whim, which seems to be exactly what just happened here. I mean, if the science does say eventually that yes, you can mix Sinovac with AstraZeneca and it's perfectly fine and you're not going to get sick from it, then that's okay. But people, and Thai people and foreigners in Thailand, are not guinea pigs, and it should be studied thoroughly before anything is done. And that's basically what the World Health Organization has said, and that's what now the Prime Minister has said. And on this note, I will give him credit for stepping in and stopping it. The Cabinet has approved a 42 billion baht package of financial assistance for people and businesses affected by the government's partial COVID-19 lockdown, currently implemented in Bangkok and 9 other provinces to contain the coronavirus outbreak. 42 billion baht required to finance this new compensation program. 30 billion baht will come from the government's loan decree for COVID-19 relief purposes, while the other 12 million baht will be drawn from the government's budget. Now, if we look through a summary of it, 42 billion baht has been set aside, 30 billion baht for cash handouts, and the rest for subsidy discounts on electricity and water bills. Employers and employees in 9 business groups will receive financial assistance. They are construction, hotel and food service, arts, entertainment and recreation, other types of service businesses, auto retail and repair, cargo transport and depots, management and support activities, science and academic activities, and news and information and communication. More business groups to receive financial aid besides eateries: 1 Tambon, 1 product, that's OTOP, general outlets, shops offering services, public transport, that's not including large-scale enterprises. Financial aid will be offered for 1 month, but it could be extended later depending on the COVID-19 situation. So we can break down some of the assistance that's been offered. Employees under Section 33 of the SSA will get 50% of their usual monthly income, at most 7,500 baht per person, and another 2,500 baht for only Thai employees per person per month. At most 10,000 baht in total per person. Employers under the Section 33 of the SSA will get at most 3,000 baht for each of their workers, but for not more than 200 persons. Workers under Section 39 or 40 of the SSA will get 5,000 baht each. Casual workers will be required to register under Section 40 of the SSA to be eligible for the same 5,000 baht handouts. So as you can see, there is some money going to people who are currently without work in Bangkok, but in my opinion, it's way too little, too late. This should have been going on for the entire pandemic when all these businesses had already been closed, not just now. I mean, it is something, but as I said, it's just way too little, too late. When you hear the figures that I've read out, what do you think of them? Do you think, wow, that's super low? Or do you think, well, Thailand isn't a very rich country, so those payments are probably sufficient for people who live here? I'd love to know your comments and thoughts on it, if you could just leave it down in the comment section. And now for a roundup of the news stories of today. The majority of over 50 cases of fake news being probed pertain to COVID. Police are investigating more than 50 cases of fake news as reported by the Digital Economy Ministry's Anti-Fake News Centre since June, the deputy spokesman of the Royal Thai Police said. COVID-19 antigen self-test kits can now be purchased for home use. Online sales of the kits have been advertised even before the Public Health Ministry announcement, with prices per piece set between 220 to 700 Thai baht. Payathai 2 and Samitive Sukhumvit to provide jobs for expats. For now, the hospitals are only accepting application from foreigners who are 60 or above or who suffer from underlying conditions. The application process concludes on July 16th. Sinovac produced antibodies half every 40 days. Antibody levels in people fully vaccinated with the Sinovac vaccine decline by half every 40 days, according to findings from a joint study between Thammasat University Faculty of Medicine and the National Centre for Genetic Engineering and Biotechnology. Boone in talks to buy BioNTech Novavax shots. Thonburi Health Group plc, THG, which operates a hospital chain, says it will join hands with a state agency to import BioNTech and Novavax COVID-19 vaccines. Man changes virologist Wikipedia to include Sinovac salesman faces charges. A Thai national allegedly modified the Thai language Wikipedia entry for Thai virologist Dr. Yong Puvarawan to include that Dr. Yong is also a Sinovac salesman for Prayut Chan-o-cha's administration. He is now facing charges such as criminal defamation and maybe computer crimes. Provincial hospitals near capacity as COVID patients flood home. COVID patients looking to return to their home province for treatment should check with the intended hospital first, as hospital beds are now also becoming full up in other provinces beside Bangkok, the government said on Wednesday. GPO to sue Thonburi Hospital Group chairman for criticisms over Moderna purchase. The government pharmaceutical organisation GPO is suing the chairman of the Thonburi Health Group for defamation, the organisation said in a statement on Wednesday. Pramburi Clinic raided for allegedly selling fake Moderna vaccines. Chonburi governor orders nightly closures and requests residents to please stay at home. Vietnam are to tighten controls over social media live streaming. And the government to pass new information decree this week. Critics call the decree problematic. The government will pass an emergency decree this week aimed at battling disinformation, but critics say the act is open to abuse and could be useful to silence dissidents. Well, that's it for today, and thanks for tuning in. If the video was okay with you, hit that like button, and please don't forget to subscribe to the channel or possibly even download a podcast. We'll see you all again tomorrow, and thanks once again.